Amazing. Trace Gallagher, science-based, appreciate it.
Yep.
So 2 years in, we're starting to get some real numbers, not just about COVID, but about our leaders' response to it. So a new analysis by the decidedly non-right-wing Johns Hopkins University has concluded that COVID lockdowns in 2020 didn't work. This is a direct quote from Johns Hopkins. While this meta-analysis concludes that lockdowns have had little to no public health effects, they've imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. Sorry for the raised voice. It wrecked people's lives, millions of people's lives. But Tony Fauci said they were absolutely necessary to save millions. Remember?
The fact that we shut down when we did, and the rest of the world did, has saved hundreds of millions of infections and millions of lives.
And he's still in charge. Martin McCary should be in charge. He's not. He's a surgeon and public health policy researcher at Johns Hopkins. He joins us tonight. Doctor, thanks very much for coming on. It's so frustrating to read this, to read the top line analysis from this study, that I'm just going to stop talking and ask you what you make of it.
Well, it's interesting. There's really only been one narrative on this entire topic, and it's probably one of the biggest interventions in the history of public health. And this study, which came out today from my institution, looked at 34 different studies that asked this question, and they concluded that the lockdowns had no significant reduction in mortality and an aggregated reduction of about 0.2%. Now compare that number, which turns out to be about 1,800 individuals, to the number of non-COVID deaths, what we call the excess COVID, non-COVID mortality in the United States. It was 124,000 excess deaths in year one. So over 2 years, it was about 250,000 people who died. Many scientists have not begun to peel back this number to understand why were more people dying than the normal death rate in the United States for reasons not related to COVID. Well, we're now understanding that 60,000 to 70,000 of them died from substance abuse, deferred cancer care. That statistic takes years to accrue. We know about the self-harm and suicide numbers. And there are hundreds of kids in Baltimore alone that the teachers described never logged on to their virtual learning modules ever. And they were lost to follow up forever in the school system. So we're now starting to recognize the collateral damage. And by the time we finally get the research that catches up with public opinion, people may already have their own narrative written. Johns Hopkins itself did not even put out a press release about this study. And if you look at the media coverage, it's one of the biggest stories in the world today, and yet certain media outlets have not even covered it.
You know, you hear people say the architects of these policies should be brought up on felony charges, imprisoned or whatever. Let's just start with telling the truth. Don't you think it would be a palliative, it would be good for everyone if they would just admit that they were wrong? Why is that so hard?
Well, look, I've done that for myself. I called for the lockdowns, Tucker, when we saw what was happening in China. It was scary. We didn't know if we were going to lose 100% of our nation's children. Right. And pretty quickly, we started to get the data from northern Italy that showed us that not only was it not equally distributed in the population, but the harm was so profoundly skewed towards older people and people with comorbidities. Even in the early days of New York, we got data that was largely ignored, that 80% of the deaths were in people over 65, and half of them, roughly, were in nursing homes. And yet we continued to treat this as if everybody was at equal risk. And we continue to do that today in schools where children bear the biggest burden of the restrictions in this country. So I think the public is hungry for honesty and basic humility from public health officials, because you've got to evolve your position as the data come in.
That's exactly right. I thought Saddam had weapons of mass destruction. I was wrong. And I'm really sorry about it, but it's okay. You can admit it. I wish they would. Thank you for